My name is Brian Nichols, and today we're going to talk about injury identification, assessment, and prevention. All right, so quick little overview. I'm going to discuss which sport and why I've chosen that given sport. Then I'm going to discuss any factors that may cause injuries, such as age, environment, gender, etc. Then we're going to talk about 3 common injuries in said sport. And then lastly, the most of this discussion is going to be geared towards the mechanism of injury, or MOI, the anatomy of the injury, assessment, treatment, and then rehab/preventative exercises for each of the 3 identified injuries. Okay, so baseball. Why baseball? Well, because it's America's pastime. I grew up playing baseball. I love it. So there you go. Baseball is considered a throwing sport, and because of that, you have a lot of shoulder flexion and elbow extension, which means that most of the injuries are going to surround the shoulder complex and the elbow. Okay, so 3 factors, or a couple of factors that go into injuries in baseball. The first one would be the college-age student athlete, typically between the years of 18 and 21. That is where most of the injuries that we see occur, just because of the high, fast-paced game, and also because these student college athletes have so much pressure on them to try to make it to the higher level, to the major leagues and whatnot. So you see kind of a lot of injuries with that. You see them earlier than the college age, but you don't see them as frequently as you would a student college athlete. So some other factors are breakaway bases. If you were to include, or if an organization were to include breakaway bases, this typically reduces the chance for injury, although not to the shoulder or elbow, but just any other injuries from sliding or tackling into bases. A good coach or an athletic trainer should also inspect the ground for uneven surfaces, holes, divots, glass before any game. And then also, any good coach worth the salt should be assessing the weather prior to the game, for hazardous weather conditions, such as lightning or rain or whatnot, that can increase the chances of injury. Okay, so 3 common injuries. The first 2 are related to the shoulder, and the last one is the elbow. So the first one is rotator cuff tendonitis or impingement, which is basically inflammation of the rotator cuff muscles. And then one step further from that would be a rotator cuff tear, which is usually the supraspinatus muscle. And lastly is the ulnar collateral ligament tear in the elbow. Okay, so let's talk about the first shoulder injury, which is the tendonitis in the rotator cuff. There's 2 types. There's the impingement, which we talked about, and then there's also a tearing, and this is also caused from degeneration as well. So this affects the glenohumeral more so than the girdle, obviously, because the rotator cuffs sit or surround the girdle. I'm sorry, the glenohumeral joint. So typical mechanisms of injury, since baseball is a throwing sport, you'll see it in pitchers. So it's throwing that really causes it, or overuse injuries, or degeneration of those muscles. So if we look at the shoulder, the rotator cuff muscles, anatomically, sorry, what you'll see is 4 muscles that make up the rotator cuff. An acronym that I always use is SITS. It's easy to remember. That's supraspinatus, the infraspinatus, the teres minor, and the subscapularis. Now, with most of the rotator cuff tears, what you'll see is a tear in the supraspinatus, which if you can see in the picture, that's actually what's being torn. Some special tests that you can do to figure out what type of shoulder injury you have are the sternoclavicular joint instability tests, and this would be for both the glenohumeral and the girdle. The glenohumeral instability test, as well as the drop arm test, which is used for supraspinatus muscle weakness test, just to see. As far as treatment goes, I've listed two types of treatments. These are obviously both non-surgical, since I'm not a surgeon. Which typically, if you're not a surgeon, you're going to go with the PT route or the physical therapy route. And so, any athletic trainer, worth the salt, is going to have to know what types of treatment there are for physical therapy. So, this kind of ties into the rehab and also prevention of the injury itself. So, in this link, I have a video of an exercise that you can do sort of to rehab or to prevent possible shoulder injuries. I'm not going to play the video. You can just click on the link and watch. But it's external shoulder rotation with the dumbbell or lateral rotation. And with these types of injuries, the main focus is to really strengthen the rotator cuff muscles because that will help prevent future injuries, or it'll also help rehabilitate current injuries such as like a stage 1 or stage 2 tear of the rotator cuff muscle. Also, going back to treatments, simple treatment could just be changing the motion of whatever caused the injury in the first place. You could just modify it. That's not always possible, but it should definitely be considered. Okay, so let's talk about the second injury, which is impingement. So as we discussed, the supraspinatus muscles, again, those are SITs, supraspinatus, infraspinatus, teres minor, and subscapularis. You typically will see this, you'll see a bursitis in the shoulder. And what happens is that space gets occupied and causes the rotator cuff muscles to sort of hang up on that, and it can be very painful. So the most common mechanisms of injury, obviously, for this are going to be the same thing. It's going to be, you're going to see it with pitchers because of the throwing and the overuse, and then also it could be caused from just degeneration. So the muscle just weakens and deteriorates. So if we look at the shoulder impingement anatomy, you'll see that there's a reduced space in the subacromial process. And that just puts tension on the supraspinatus tendon, and the bursa also gets inflamed, which is why you'll see rotator cuff tendonitis, which just means inflammation of the tendon, or the bursa sac in this case. Some tests include NIRS tests, the Hawkins-Kennedy test, the supraspinatus muscle weakness test, which is the arm drop test, which you could have done in the other one. For the shoulder or rotator cuff tear, and then also the empty can test. And these tests really just help you gauge as to how far or how minimal the damage could be done. And as an athletic trainer, you'd want to know some of these things. So here, I also give you two treatments. They're both going to be obviously physical therapy because it's going to be non-surgical. And again, the main focus should be to strengthen the rotator cuffs. Because what happens a lot of the time is that in throwing injuries, the arm or the way that the pitcher is throwing causes a lot of instability in that shoulder girdle, and so you can get a lot of inflammation, and then injuries obviously ensue. So some rehab and prevention exercises are basically the same thing, the external shoulder rotation. But there's a couple different variations that you can do. You can do the standing shoulder external rotation. You can also do it with a cable. You don't have to do it with dumbbells. But it should be lightweight. The focus should be really, really light. 3 sets, 10 reps each, and once per week, and then progress from there. You can increase the weight, or you can increase the frequency. But you should never lift too much, just because the rotator cuff muscles can get overpowered so easily. Okay, so the last injury is the elbow injury, or the UCL, the UCL, which is ulnar collateral ligament. And you can see here in the picture on the left, this is typically where it happens during the cocking phase. You'll see the tension on the UCL. And one common treatment for this is actually surgical, known as Tommy John's, which used to be considered the kiss of death, but now the surgeons have progressed so much now that really anyone that has gone through this can almost have a full recovery in up to about 18 months, I think, which is not bad. Some have even seen sooner. to just returning to light duty. So with that surgery, I'm just going to talk about it really quickly. What they do is they'll drill 2 holes in the humerus, 2 holes in the ulna. Then they'll take a tendon from either the forearm or the hamstring, and they'll kind of weave that in a figure 8 pattern just to hold the humerus and the ulna together. Just because the UCL, which is the entire point of that ligament, is to hold those together, is either weakened or torn. So typically what you'll see is irritation or pain is a sign surrounding the elbow joint. That usually means that they'll have something going on, and so you'll want to definitely check that out. And the main causes or mechanisms of injury with this is in pitchers is throwing. So you'll see overuse or high repetitive stress on the UCL. If you look at the anatomy a little bit, that you'll see that it's a tear of the UCL attachment at the ulna and the humerus. And then if we look at the elbow joint, you'll see the humeral ulnar joint, the humeral radial joint, and the proximal radial ulnar joint. And then right in there, in between, is where you'll see a torn ulnar collateral ligament. Okay, so some special tests for identifying and assessing the UCL injury would be the valgus or varus stress test, the capsular injury test, the lateral and medial epicondylitis, lateral and medial epicondylitis test, the pinch grip test, and then lastly the pronator teres syndrome test. So I discussed the surgical treatment, which is that Tommy John surgery, but 2 other alternate treatments that are not surgical, depending obviously on the tear. In a throwing athlete, I listed here, which is going to be, again, physical therapy. So some exercises to rehabilitate or prevent the injury altogether. One exercise that I like in particular is the lying tricep extension done with a dumbbell, used obviously with really lightweight. And you want to get in there and strengthen not only the ligaments that surround the elbow joint, like the ulnar or the ulnar collateral ligament, but also the muscular tendons that are in there as well that attach directly to the elbow joint, and in particular the triceps is one of the muscles that you'd want to definitely strengthen. So a lying tricep exercise is going to be great for that. 3 sets, 10 reps, once per week. You can increase weight or frequency, but you should always try to do lightweight until you're fully healed. And then these are one of those exercises that actually kind of have a crossover effect into the strength training realm, because in the strength training realm, this is actually just a great exercise anyway to strengthen that joint as well as the muscles surrounding it. Okay, so I've identified which sport and why, and I've identified some factors that can cause injury. I've also listed 3 common injuries within the sport, and then I've went over the MOI, the anatomy, the assessment, treatment, and rehab/preventative exercises. Okay, thanks for watching.